I got pregnant at the age of 39. I actually chose to give birth here in Albany, Med. I was born here, and even though we live in Scotia and there's 4 hospitals within a 10-mile radius from where we live, I knew that I wanted to give birth here. God forbid there was something wrong with my child, I was at the best children's hospital around. They were monitoring Logan's kidneys. The last ultrasound, they noticed fluid on his brain, which prompted emergency MRI. At that emergency MRI, they found a hemorrhage in his brain. The next day we had an emergency C-section. He spent 5 days in NICU and everything was fine, so they agreed they were just going to monitor the hemorrhage. We came back on March 8th last year, 2017, and the hemorrhage was gone and this ginormous tumor was there. They did a biopsy that day. The first meeting we had, they said, "We're so sorry. Your son has a glioblastoma and there's nothing we can do."
Glioblastoma is a very aggressive form of a glioma, which is a common tumor that children can get. What was unique about Logan and what we realized was that his was actually a congenital glioblastoma. And we knew that because looking back at previous images, we saw even in utero he had this tumor. And so a congenital glioblastoma tends to have actually a better prognosis. This type of tumor is exceedingly rare. There's only about 100 reported cases ever. And so with the Children's Oncology Group, which we're a member of here, I was able to reach out to a number of other neuro-oncology experts with experience treating this tumor to come up with the best regimen to treat Logan. And we were able to do everything here. So with our interdisciplinary team with neurology, neurosurgery, and myself, we were able to coordinate all his care such that we could use expertise from around the world, but give it to Logan here at Melody Center.
So we lived for the better part of 6 months in Albany, Med. And he received 5 rounds of very aggressive chemo. He was on steroids, he was bloated, he lost his hair, he had a horrible diaper rash, 2 major craniotomies while he was inpatient. To date, he's had 15 surgeries total. We were very lucky to have Albany Med in our backyard. They were monitoring Logan's hemorrhage when he was born, so all his doctors, Dr. Adamo, Dr. Nichter, Dr. Weintraub, he's had since the day he was born. So we've had this team of doctors that have been so supportive. They know my son. We have such a great relationship with the staff, with the nurses. We go above and beyond. So the hashtag Logan Strong, just, you know, that's the thing you do, I guess, when you're trying to raise awareness, and it just really took off. I believe in the power of prayer. I believe in the power of positive thinking. My husband and I are very positive people by nature, where, you know, you get what you give.
He's doing very well. He has no evidence of disease recurrence on multiple follow-up imaging. He's tolerating the chemotherapy very well. So our expectation is that he's going to have a good prognosis.
And I just feel you have to look at the positive. You just can't, because the worst case scenario I won't allow to happen.